In this movie, we will be showing our multiple patient visualization application. We will explore the lab results in the bone marrow domain. The group shown is the patient population which we retrieved with our Query Builder tool. By using our search engine, we will open up the white blood count lab results for this population. The graph that is now popped up in the upper part of the screen represents all lab results. We can pan along the x-axis and zoom in and out, drilling down to the desired granularity. As the graph is full, we will use our tools to get to the desired data. This will allow us to research the data in any number of ways. We will now add statistical parameters, such as the average and percentiles. The average will be shown by the green line and the percentiles by the pink. These results will allow us to search for any abnormalities and better understand what is normal. Our novel way to explore the data is by using the state representation graph. This graph shows the lab results, and they are mapped to the relevant medical concepts by taking the raw medical data and mapping them to the relevant concepts. In our example, in July 1994, 50% of the patients had a very low WBC state, while 37% of them had a normal WBC state. In order to understand how we build the state, we must show the knowledge which has already been defined via our knowledge acquisition tool. This table shows the raw medical data of the white blood cell counts. In our example, you can see that the mapping between values of 0 and 0.1 have been mapped to very low state. That is the medical concept specific to the bone marrow transplant domain. Therefore, this is done only for that domain, as different domains will have different states. In order to demo one of our most interesting technologies, we will open up other state graphs, such as platelet state and hemoglobin state. This will allow us to explore the data in relative time. In the upper part of the screen, we can choose between two different types of bone marrow transplant operations. Choosing the upper one, the pop-up window shows that some of the population have not met the criteria. Relative time is represented by the dotted line here in the center of the screen. As you can see, the x-axis has now been changed from calendar entries to lapse time from the operation date. For example, in the white blood cell state, you can see that 57% of the population had a very low value 1 month after their surgery. We have successfully accumulated their data based on relative time, irrespective of the actual calendar event. This brand new technology allows us to explore the behavior of populations and shows how they were affected by the surgery. Clinicians and researchers now have a new tool that helps them discover new data patterns and relationships. An important medical question that the researchers wished to check was what was the effect on the white blood cells before and right after surgery. As we can see here in the graph, 1 week before the operation, white blood cell counts started to drop due to the drug regime pre-op. They stayed at the very low level after the surgery and for a period of 9 days. The white blood cells slowly started to climb back to normal after 16 days. This graph was extremely helpful to the medical team in dealing post-op with the patients. Another important technology is our association graphs. These show the relationships between different data sets and can be seen in a separate movie. For now, we would like to compare patient results between two types of operations. We will now open another WBC state graph and select the relative time for an operation entitled BMT-AU and another one for an operation entitled BMT-AL. As you can see, some patients did not meet the criteria. Here we have the two different graphs. The upper graph, as you can see, is BMT-AU operation, while the lower graph is the BMT-AL operation. You can also see now the dotted line, which is the relative time set. We will now point out a few of the important differences that our system was able to show to the clinicians and researchers. As you can see, in both types of operations, the white blood cell count started to drop before the operation. But as we can also note, we can see the differences between the results of the two operations. In the AU upper operation, the very low white blood cell counts lasted until the end of the 9th day, while in the AL operation, some patients were in a very low white blood cell count until the end of the 18th day. We also note that in the AU operation, the return to a normal blood state was much quicker. As we can just see here, on about the 16th day, already 68% of the patients had a normal white blood cell count. While in the AL operation, it wasn't until the 23rd day that 64% of the population was at the normal count. In order to visually show this in a different way, if we add now the 50th percentile to both of the graphs, we can graphically see that in the upper AU operation, at the end of the 12th day, 50% of the patients were at a normal WBC level. But in the AL operation, it wasn't until the 21st day that 50% of the populations had a normal white blood cell count. The researchers and clinicians were extremely impressed by these results, which led to changes in the operations.